So we'll now move on to the next speakers of the block, Ryanna Bowling and Rachel McGihon from the Canadian Institute for HealthInformation for a presentation called Developing Modernized Organ Donation and Transplantation Data and Reporting System, a Lens on Patient Family Donor Engagement. So Ryanna Bowling is a program lead at the Canadian Institute for HealthInformation, CIHI, responsible for stakeholder engagement for the ODT Data and Performance Reporting Project. And Rachel McGihon is a program specialist at CIHI, responsible for supporting a broad set of stakeholder engagement and content development activities for the CIHI-Infoway ODT Data and Performance Reporting Project. So now over to you, Rachel and Ryanna.
Thank you, Chloe, for that introduction. And I have to say, Fraser, your presentation and the film that you shared with us was incredibly moving. And I thought about how I could possibly follow to pivot to focus on data. And what came to mind is that your film is storytelling and data can also tell a story. So I hope in the next 15 minutes, you can hear and learn how this project is aiming to modernize the way that data can be a powerful tool and can hopefully help inform decision making. And we'll share that with you now. So next slide. So I want to acknowledge that I live and work on the traditional unceded territory of the Algonquin Anishinaabe. I know that we're joining from many other regions across the land, and really appreciated that we posted that in the chat today. Next slide. So what we'll cover in our presentation is that we'll give you a bit of a background on the existing data that we have at CIHI. Also familiarize you with the project that we're co-leading with our partners, Canada HealthInformation. I'll then turn it over to Rachel, who's going to highlight the engagement we've done with patients, families, and donors to date, and preview the upcoming work we hope to do. So we'll get started. Perhaps I could get a show of virtual hands for those who may be familiar with the Canadian Institute for HealthInformation, CIHI, and its existing organ donation and transplantation data. So I see several hands popping up now. It's so nice to see. For those that are not familiar, I'll just spend a brief moment to go over our organization so you can learn a bit about us. We're a not-for-profit private organization founded in the 1990s that really provides essential information on Canada's healthcare system. And we work closely, our goal is to work closely with partners and stakeholders across the country to gather, package, and share data with a goal that leads to better decision-making, better health outcomes, and healthier Canadians. Next slide. Here you'll see we do have a range of data holdings. So we host extensive linkable data from across the country and across the healthcare continuum. And where the organ donation and transplantation data fits in is under our clinical registries. And that registry is called the Canadian Organ Replacement Register, or CORE for short. And we love our acronyms here at CIHI. So we can go through to the next slide. I'll just speak a little bit about CORE. So for those who aren't familiar, CORE collects pan-Canadian information on organ failure and organ replacement, and it's been doing that since the early 70s. It covers longitudinal patient data on dialysis, ODT, but it's really captured only for those who have had a transplanted organ or procedure, but it doesn't cover those with missed referrals or the patient-reported experiences and outcomes, which are so important to measure. I say that because it'll segue nicely into the rationale for our project. But I do want to highlight first that the latest data that we do have available will be released next week on June 15th, and that'll be summary statistics that you can find on CIHI.ca. One of the other pieces about CORE is that the way it's collected is mostly reliant on older technology. You would be surprised, when you go to a hospital to see paper, fax, phones still being used to share information. So there's a strong need for digital solutions and modernization. So that really segues nicely into an overview about the project itself that we are working on. So there is a clear need for a modernized pan-Canadian organ donation and transplantation system. And hopefully what I've shared gives you that rationale, but here's a bit more about the reasoning for where we're at. So next slide shares that in 2018, our federal government recognized that there was an opportunity to really transform the way we collect data. In that report, they called the lack of a data system and the performance reporting indicators really an Achilles heel of the system for ODT in Canada. There was CIHI-Infoway then were mandated or given the mandate to partner together on this multi-year initiative. And it is quite an ambitious project. So I'll go over some of the work streams that we're leading, and then we'll really get into how patients, families, and donors are going to be engaged on that work. So the vision for the project in our next slide really covers that we want to create a world-leading data-driven system that would be informed by high-quality, timely information and really optimizes access, efficiency, quality, and outcomes throughout a patient's journey for the benefit of patients, families, and donors. So some of the goals of that or the outcomes we want to see out of this project include being able to better measure how the system is performing, to provide transparency, to stimulate research and innovation. We're also aiming to decrease wait time, improve outcomes for transplant recipients and living donors. And last, it's really to be able to measure the progress towards a system that provides timely and equitable access to quality transplants that hopefully last a lifetime. In the next slide, you'll see that we have 5 work streams that I'll walk you through. On the left, you can see that the first work stream is to develop and identify what's important to measure, what's important to capture in terms of data. And that involved a rigorous prioritization process, which patients were in, you can go previous, thank you so much. Patients were engaged through a survey. You can see the little icon above the indicators that denotes where we have patient, family, and donor engagement across this project. And so indicators was a big piece. In parallel, we also developed pan-Canadian data standards. And these data standards include the ability for the data to talk to one another, and that term called interoperability. So those standards are key to be able to feed into what's being collected at the hospitals, at transplant centers, and organ donation organizations. And that's where you can see the middle icon is where our partners, Canada HealthInformation, or Infoway for short, are leading very important work to modernize and provide digital solutions to be able to make those systems talk to one another from across the country and really optimize the way that we're sharing information and the way information is going to come to CIHI. And in parallel, we're doing a design, build, and launch of a new ODT data system that houses the data at CIHI. And we are working very diligently to be able to get and receive that new data through all these mechanisms that we've spoken to date. And finally, the end goal is to really be able to share this information, right? Through timely information, secure and public types of reporting for the benefit of the public, for decision makers, for our clinical researchers. And so, as you can see, we've highlighted that box because, of course, patients, families, and donors are key to being able to inform what's important and how best to present this information. And I'll pause there because really this is where I'll turn it over to Rachel to share how we're going to make that happen and the work we've done to date. Thank you so much.
Great, thanks, Ryanna. So I'm going to jump into the next section of our talk now. So as mentioned, my name is Rachel. I'm a program specialist at CIHI and very honored to have the opportunity to speak with you all today. So in the next half of our presentation, I'm going to present a summary of patient engagement that we've done to date, and then we'll talk about what we have planned for further engagement with patients. So we have been actively engaged with patients over the course of the multi-year project. And on this slide here, you'll see that we've listed the patient engagement activities that we've completed to date. This includes updates to Health Canada's Organ Donation and Transplantation Collaborative Data System Working Group, ad hoc updates to the Collaborative's Patient and Advocate Advisory Committee, attending external webinars and events, social media promotion around key ODT awareness events, and lastly, ODT-focused episodes of CIHI's podcast, which you're actually going to hear a clip of in just a minute. So for engagement that's specific to indicators and measures, patients were invited to complete CIHI's indicator prioritization survey, and they responded quite enthusiastically with a response rate of almost 60%. Patients were also active participants in the CIHI-hosted indicator prioritization discussion sessions across all clinical journeys for deceased donation, living donation, and transplantation. And lastly, for reporting, CIHI's collaborated with an external vendor to complete user experience discovery workshops, which included one-on-one interviews with patients. And in the coming slides, we'll present our plans for additional engagement on public reporting. So before we do that, to help us learn more about effective patient engagement and develop our own patient engagement plans, our team has consulted with several groups, both internal and external to CIHI. And we've listed here a summary of what we've heard to date about what the best practices are for effective patient engagement. So these things include ensuring diversity in patient voices, having at least 2, but ideally more, patients per group or session to help create a safe space for sharing, aiming for interactive sessions that provide opportunities for patients to speak and share their own stories and opinions, partnering with patients to plan and deliver engagement activities, providing recognition for patients who are generous with their time and contributions, and lastly, hosting virtual sessions to help increase accessibility and participation. So we know that folks on today's call have a lot of experience in this area. So if there's anything that you would like to add to this list, we do appreciate any additional insight, and we welcome anything that you'd like to share in either the chat box or at the end of our talk today. Great. So as I mentioned, CIHI does have a podcast. It's called the Canadian Health Information Podcast, or CHIP. And there are 2 episodes of the podcast that are ODT focused, one in English and one in French. Both of those episodes feature a clinician and a patient who have been actively involved in the CIHI-Infoway project. So in a minute, we're going to play just a short audio clip from the English episode so that you can hear from Sandra Holdsworth. She's unfortunately not able to join us today, but we suspect that her name or voice may be familiar to many of you on the call. So I'll start that in a minute. And when I do, I'll maybe just ask if one of the CDTRP organizers can give us a thumbs up so that we know the audio is working.
Patient, I've looked at CIHI for over many years. I use it for what I refer to as my advocacy work about bringing awareness to organ donation, because I don't know, it just seems to be something that transplant recipients, it's their way of giving back, especially when, we don't know who our donors are, and we just, we don't know who to thank, right? So the information on there is amazing, being able to share like how many people are waiting, how many organs were transplanted. And I really like the fact that CIHI is doing things that I consider more patient and layman's friendly, because they're doing infographics. And so I'm all about knowledge translation, and I think infographics and putting things in an executive summary that's easy for someone to look at, then the general public will get more information on it and they'll understand.
Great. So what you just heard from Sandra about the importance of CIHI's data and knowledge translation is actually a great introduction to what we're going to talk about now, which is our plans to work with patients to identify how we can best visually present our data to hopefully ensure that it's both useful and understandable. So moving into our upcoming plans for ODT public reporting, on screen here is a timeline for the public reporting work. Starting on the left-hand side of this slide, the CIHI team has completed user requirements and we're working on the design for an ODT public reporting tool. In the upcoming year, we will build, test, and deploy the first public reporting release using existing CIHI data sources. And our planned approach to patient engagement for public reporting is through a virtual patient family donor focus group in the fall or winter later this year, during which we'll seek input from patients on how we visually display and communicate about publicly reported indicators and measures in preparation for this first public reporting release. Moving along the project timeline and into year 6 and beyond, we will continue to update public reporting tools and products as new ODT data becomes available. And that will be done in a cyclical manner with public reporting to focus on a subset of indicators. For anybody who's interested in that full list of 78 indicators that we prioritize, there is a summary report on this work that's available on our website at cihi.ca/ODT. So here's a draft list of indicators for inclusion in that public reporting release 1. This initial list includes up to 13 indicators that span deceased donation, living donation, and transplantation patient journeys. As mentioned, we'll leverage existing CIHI data sources to calculate these indicators, and these will then be further broken down by organ, demographics such as age and sex, and other clinical factors, and then the results will be available at both the provincial and pan-Canadian levels. So back in March, we presented these plans for public reporting.
Warning.
Oh, thanks. So we presented our plans back in March to the Organ Donation and Transplantation Collaborative's Patient and Advocate Advisory Committee. We were very happy to receive interest from 4 individuals in that group who would like to partner with us to plan and co-facilitate our virtual focus group later this year. And again, the purpose of that focus group will be to solicit input from patients on how we visually display data. For example, with infographics, which you heard from Sandra is something that patients are very much interested in. So we're very excited to begin that work soon, and we'll have more information to hopefully share with this group and beyond in the coming months. So just to wrap up, we do invite those on the call today to visit both the CIHI and Infoway ODT project web pages to learn more about our progress. And we welcome any questions that you may have. Our CIHI email address is listed here. It's odt@cihi.ca. And with that, we'll finish up, and I'll just thank the CDTRP for the opportunity to present. Thanks everyone on the call for attending our session, and we're happy to answer any questions.
Great. Thank you so much, Rachel and Ryanna, for a very informative presentation. I know there is quite a number of questions in the chat about how to get involved, and but maybe we'll take 1 or 2 for you guys to answer. Patricia asks, are you assessing the effectiveness of these different patient engagement activities, like the reach of the podcasts? Yeah.
Thank you so much, Chloe. And thank you, Patricia, for your question. That's a great one. So at CIHI, we measure everything. So there are certainly digital analytics and metrics on the podcast. In terms of the effectiveness and reach, we do measure the number of shares, likes, and interactions on our social media channels where the podcast was shared as well. We can certainly gather that and share with you if you're curious. But I do agree it's really important to measure what types of mechanisms are the best to be able to engage with patients, families, and donors in order to truly seek their input and have a broad reach.
And then Micah in the chat is asking if the data will be available by donation region. For example, Ontario has more than 1 region.
Yes, and Thank you, Micah. That's a great question. So we certainly do have granularity for the data beyond just by province. How it is presented on our public websites is based on CIHI's policies and procedures. So in some cases, we don't release that level of granularity on the public domain, but it would be behind a secure access. So depending on the type of data presented, we would present it appropriately. Hope that answers your question. And I see a message from Fraser. I'm just reading it now. So Fraser, thanks for presenting that video. I think that it was incredibly moving, and to follow with the story of importance of data is a difficult one, but I can see in the chat that everyone is anxiously awaiting your full feature. So we are as well. So looking forward to following along.